Tackling the challenges of ovarian cysts, experts say requires a multifaceted approach, including improved healthcare infrastructure, increased awareness, and accessible treatment options. Ovarian cysts are common in Nigeria, but challenges exist in diagnosis and management due to a knowledge gap among the public and some healthcare providers. The high prevalence of conditions like polycystic ovary syndrome and limited access to specialized care. Many women are undiagnosed, leading to potential complications like infertility, since 1 in 6 infertile women in Nigeria may have polycystic ovary syndrome. Our Torchlight tonight flashes on the overview of this prevalent health condition among women of reproductive age. Good evening and welcome to Searchlight. I am Kelechi Ochiara. Welcome back. The news in details. The Minister of Works, Senator Nta Enugu, has directed the contractors handling the Enugu-Port Harcourt Expressway to complete the remaining 4.5-kilometer Abia section before the end of November. Umahi gave the directive after inspecting the progress of work on the project. Informer Nta Enugu now reports.
An inspection visit to the project site with the Abia State Governor, Senator Umahi expressed dissatisfaction with the pace of work, describing the delay on the 4.5-kilometer section as unacceptable. The minister, while assuring the contractors of prompt payment, described President Bola Tinubu's administration as reliable in fulfilling financial obligations. He commended Governor Alex Oti for his support for federal projects and his commitment to the development of the state.
The president has shown very serious attention in the affairs of Southeast, and the road infrastructure is one of such. Under President Bola Tinubu, we are looking for partners. We are not looking for contractors that will stop their work just because they are being owed 2 billion or 3 billion. The president, it's not the time that we ask you to work and will not pay you. I'm not happy with the progress of work in this 4.5 kilometer out of 112 kilometers.
Governor Alex Oti reaffirmed his administration's commitment to ensuring the completion of the Abia segment of the project.
I have extracted a commitment that we will commission this place by December. Whatever it takes. Like the Honorable Minister said, I'm going to be coming here from time to time. I live here with you. And if you need anything, please let me know.
The Federal Controller of Works in Abia, Chidi Uwezozi, confirmed that the Enugu-bound axis of the expressway has been fully completed, while the Port Harcourt-bound axis is at advanced stage, with only the 4.5-kilometer section left. In Umuahia, Informer Nta Enugu, Nta News.
Aside electricity and water, good road network is another basic amenity that endears the citizens to any government. The road projects springing up in parts of Ebonyi State, residents say, have endeared them more to the federal government, as they are all life-touching. This resonated when NTA News visited some projects being executed by the federal government in the state. Chinaza John reports.
The 51.3 kilometers Ugeb-Abomege-Okmosi Road, a 30 minutes drive from the state capital, connects Ebonyi State with Cross River and other South-South states. The road, just like the Enugu-Abakaliki-Ogoja Road and Amasiri-Okmosi-Uburu-Mpu, Ishiago, Enugu and Port Harcourt Expressway, previously in deplorable states, are now wearing new looks with positive traveling experiences by the people.
The road is very, very good. It's his movement and compared to what we have before.
The job they are doing is very nice. We love it. Let him continue on and be doing more things for us.
We owe thanks to God Almighty We are praising him for giving us a person like Bola Ahmed Tinubu.
It's a very good thing. Like now, I can drive from Okpo City here. I thank the federal government.
Other projects visited are the flyover bridge at Onueke Junction, linking the 121.64 kilometers superhighway connecting Onueke, Ezambo, Isheke, and Mbeke in Ebonyi local government area of Ebonyi State. Bridge construction at Ndibe Beach for easy access to Cross River State, as well as the new bridge at Akmoha River. These projects for the Controller of Works, Ebonyi State Office, Steve Oluwadun, shows President Tinubu's renewed vigor to provide a strong road network that will promote unity and economic stability for Nigerians. Hence, the huge investment by the federal government.
To relieve this existing old bridge, it is discovered that the old bridge is becoming weak. This project was awarded April 2024. Got to this level May this year.
We've been recording a series of accidents here, this and that. It's a very welcome development. We really appreciate federal government for this kind of gesture, remembering us.
Since we started over a few months now, we have not encountered any issue.
These projects, with a 2026 completion target, is part of the federal government's commitment to give travelers and commuters a delightful traveling experience. What this means is that the hope of Nigerians, especially motorists, have not just been renewed, but actualized. In Abakaliki, Chinaza John, Nta News.
Searchlight returns in a while. Don't go away.
Naphtali's Hotel, 47 Ezilo Street, Independence Layout, Enugu. A moment at Naphtali's is an experience you will share forever. A luxurious suite fitted with brand new air conditioners, 42-inch plasma TV, free Wi-Fi, and basebook services, presented in a serene environment, distinguish us from the others. Our main bar, garden bar, and restaurant give you a wide choice of drinks and delicacies, while our 800 capacity fully air-conditioned hall is the ideal haven for that special event. Naphtali's Hotel swimming pool and gym are available all day, while our live band blesses your ears every Friday and Sunday. Enjoy a whole new world of top-notch hospitality in the cool city. Your security is our priority. We are Naphtali's Hotel, 47 Ezilo Street, Brown & Brown, Independence Layout, Enugu. For inquiry, call 0908-273-6086, 0908-273-6086.
Are you frustrated with travel and logistics plan? Lovefish Travel and Tours Limited is here to serve you. We provide visa assistance, proof of funds, languages classes for easy international work placement, caregiver and social work certifications, both virtual and physical classes. Are you planning a work retreat or school excursion? Do you need to ship goods across the globe? We got your back with our premium cargo services at Akami Biam International Airport in partnership with Nigeria Export Promotion Council, Southeast Regional Office, and Ethiopian Airlines. In Lovefish Travel and Tour Limited, proficiency, efficiency, and professionalism is our watchword. Visit us at number 36 Umoji Street, Independence Layout, Enugu, or call 0706 295 8388. Lovefish Travel, moving dreams, moving you.
Glad to have you back. Now, the business of the day. Clinical studies show that ovarian cancer is the second most common gynecological cancer in Nigeria. In 2020 alone, it accounted for 51% of cancer-related deaths. A situation experts say can surge if nothing is done to checkmate the ugly trend. Grace Wilson is on a fact-finding mission in the streets of Enugu to unravel the causes, effects, and treatment of ovarian cysts. The reports.
Ovarian cysts are common growths that develop on or inside ovaries. While most cysts are harmless and may eventually go away without treatment, some can cause complication and become cancerous. It is against this backdrop that medical experts advocate early screening to avoid complication in the long run.
Ovarian cyst is a fluid-filled sac that forms on the surface or within the ovary. It can result due to normal menstrual cycle in most cases and is functional. Sometimes we have normal cysts like the functional follicular cyst or the corpus luteum cyst. These ones can resolve on their own without causing any complication. But we have pathological ones like the dermoid cyst, the endometriomas, and the cyst adenoma. These ones can cause complications because, as the name implies, pathological. And in severe cases, you have abdominal pain and discomfort that might result from the torsion of the ovary.
Irregular period, pelvic and sexual pain have been identified as some of the early signs of ovarian cysts.
For the management of the ovarian cyst, it ranges from pelvic examination, and you now can confirm the diagnosis using ultrasound imaging. And for the management, the main treatment depends on the type, the site, and what is causing the whole problem. So the main management will be what we call a watchful waiting, or in layman's word, observation to surgery.
While late diagnosis and limited access to health care can contribute to high mortality rates, monitoring the cysts over time, surgery, and general treatment remain key to ovarian cyst management. In Enugu, Grace Wilson, Eze, NTA News.
Thank you, Grace, for the Bangra report. In the studio to shed more light on ovarian cysts is a consultant obstetrician and gynecologist. She is currently the Chief Medical Director, Mother of Christ Specialist Hospital, Enugu, Reverend Dr. Mary Ignatia Okafor. Sister, you're welcome to Searchlight.
Thank you.
Sister, please, what are ovarian cysts and what makes it common among women? Is it really common among women?
Thank you. Ovarian cysts, as we just heard a few seconds ago, is fluid-filled sacs that can develop and form either inside the ovary or on the ovary. And most of the time, it is as a result of the menstrual cycle. It occurs more during the reproductive age of the woman. When you talk about is it common, it is really very common. There are some women that almost every month they will have the one we call the functional cyst. They may have one functional cyst each month, while some people don't have, but many people have. But one of the key issues about this functional cyst is that it doesn't cause any trouble. It does not give symptoms, and it ends, it solves itself by not continuing to grow. And the cause of it is actually unknown. You cannot say that it is because of this or that, though there are some risk factors.
Okay. Sister, what are the symptoms and how can one identify it?
Okay. The symptoms of ovarian cyst, as I just said, most of the time, the cyst can be symptomless. It's probably when something else happens and takes the woman to the hospital that she might be told that she has an ovarian cyst. So, but some of them do present with symptoms. And among those symptoms include pelvic pain. The woman may start experiencing some waist pain. She may also start experiencing irregular menses. If she's used to having her menstrual flow every 28 days, every 30 days or thereabout, she may, after a while, experience irregularity in that menstrual flow. Also, she may experience that the flow itself changes, either that it becomes heavier or it becomes scanty, what we call intermenstrual flow. That is, without getting to the normal time that she will have her menses, then she will have intermenstrual flow. Sometimes it can manifests as scanty flow, she will notice spotting, either before the real menses or after the menses. Again, there could be frequency in urinating if the person has ovarian cyst. Because of the pressure that it can produce on the bladder, so the woman may notice that she now goes to urinate more frequently.
Okay.
Again, is that some people will come with the symptom of painful sexual intercourse. Because if the cyst, every woman has 2 ovaries, one on the left, one on the right. If any of the ovaries develops a cyst, the size of it may cause discomfort, either when the woman is going to pass feces or during sexual intercourse.
Okay.
So some of these are ways that the woman may notice that something is happening. Or sometimes it may come with bloating. She will feel full, as if she has eaten something that she is not, she has eaten food, or she is full, she doesn't feel like eating. So bloating of the abdomen, easy fullness, frequent urination, difficulties that when a woman notices that she's having any of these things, should report to a medical expert. So then, when this medical expert hears her story, which we call taking her history, the next thing to do is to do a pelvic examination.
It's okay.
So
I wanted to ask you the kind of text one can conduct when such symptoms comes up.
Okay, so that's just what I've mentioned, that when a woman notices any of these symptoms that we have mentioned and reports to a medical expert, the test that will be done will start with pelvic examination.
Okay, it's all right. It's all right. Thank you, sister. Hey, is ovarian cyst cancerous? Could it be cancerous?
Oh yes, it can. Though majority of the ovarian cysts are not cancerous. It can be functional cyst, but it can also be cancerous. And the types that are cancerous, most of them may occur either around the time of menopause or after menopause. But it can be cancerous, but majority are not.
Okay, when is it said that a cyst is pathological?
A cyst is pathological if it is causing problem for the patient, for the woman, because it can be pathological in the sense that it is cancerous. It can be pathological in the sense that it is affecting the woman's general health. Like there are some of them that can affect fertility. Ovarian cysts like polycystic ovary can affect the general health of the woman and can affect her fertility, because the polycystic ovary, among all the effects of it, will affect her ovulation. And once ovulation is affected, conception is difficult.
Okay.
Then if it is the one that goes with what we call endometriosis, endometriosis is a problem of the inner lining of the uterus. And sometimes it produces these fluid-filled sacs on the ovary. So but this time it will be more of bloody color. And that endometriosis that produces disease that we call endometrioma. So it will go with pain, with heavy menses, and it's all, so though it is not cancerous, so but it is pathological in the sense that it affects the general health condition of the woman. It will affect her fertility, and it will affect her productivity in wherever she's working.
All right, Sister Okafor, I want to know, our viewers might want to know whether there are treatment options in treating ovarian cyst.
Yes. Number one is that we must remember that majority of the ovarian cysts are not pathological. So those ones, they don't need any treatment. In fact, what happens most of the time is that if you go for ultrasound for any reason at all, and you are told that you have a functional cyst, we gynecologists do not do anything about it. We counsel the woman and reassure her, and probably in the next 1 month, 2 months or so, it will disappear. So those ones don't require treatment. We call it watchful waiting. So, but the ones that are either by the size or or the type, because there are those ones that, apart from the functional cyst, there are other types of ovarian cysts that are not cancerous but can give problem. So most of the time, the treatment will be surgical.
Okay.
Though some people will opt for using oral contraceptive to prevent further development. So with the likes of me, I don't use that because oral contraceptives have its own side effects. So you may take it to prevent functional cyst developing, but you are indirectly, creating avenue of laying foundation for another trouble some other time.
Okay. How does this affect fertility among women of reproductive age?
Okay. Thank you. As I've said, that the types that we call polycystic ovary definitely affects fertility by making ovulation very difficult. So without ovulation, the woman cannot conceive.
Okay.
And if it is the one that follows endometriosis, because of the pain associated with endometriosis and endometrioma, ovulation is also affected, and all the adhesions that go with it. So whether it is ovulation, whether it is the tubal factor, in various ways, polycystic ovary, endometrioma affects fertility.
Potential complication if left untreated? Your last
word. Sure. If it is a large ovarian cyst, if it's not treated, it can twist, and it can present with sudden pelvic pain. It can either twist, and we call it ovarian torsion, or it can burst. And if it is a large cyst, it can burst into a blood vessel and can lead to bleeding. So when it is left untreated, it has that complication of torsion, ovarian rupture, and all that follows it. It's a medical emergency.
It's all right. I'm afraid this is much we can take for today's Searchlight because of want of time. I have been talking with us this week for another interesting topic. Thanks for watching. Good night.